Good morning, everybody, and welcome to the next in Hourglass's webinars. Today, referencing World Elder Abuse Awareness Day 2023. For those of you who are unaware, World Elder Abuse Awareness Day started back in 2006 from the International Committee for the Prevention of Elder Abuse and has been adopted by the WHO. Something that was originally talked about in 2002 and focused the minds of the charities and organizations across the world. However, I think it's fair to say that it doesn't have quite the same profile here in the UK, and that's something we can discuss in a minute. Before we do that, I'm absolutely delighted to welcome our panelists today, and I will ask them to introduce themselves. We'll start with Carrie.
Good morning, everybody. My name is Carrie and I'm from the charity Age UK. I work in the safeguarding team at Age UK, but I also lead our domestic abuse policy and have a real strong focus on older people.
Thanks, Carrie. Hannah?
Thank you, Richard. So my name is Hannah Gousy. I'm Chief of Staff in the Office of Domestic Abuse Commissioner. I was formerly Head of Policy. I've been off for a year on maternity leave, so I'm covering Emily Fay, that some of you might know, who's currently on a career break. For those of you who aren't familiar, Nicole Jacobs is the Domestic Abuse Commissioner. She's been in post since 2019 and her powers derive from the Domestic Abuse Act. We have a number of teams in our office. So we have a policy team, a research function, a practice function, as well as a communications function. I'll leave it there because I'm sure we'll cover off our priorities throughout the webinar in relation to the experiences of older people experiencing domestic abuse. But Richard, just a huge thank you for having our office here today. We really appreciate the opportunity.
Thanks, Hannah. Frances.
Hi, everyone. My name is Frances McCausland. Richard, firstly, thank you for having us today. I represent a charity in Northern Ireland called Nexus, which is Northern Ireland's largest sexual abuse charity, but my role there primarily is the management of Northern Ireland's domestic and sexual abuse helpline.
Thanks, Frances. Thank you very much. Veronica.
Yes, good morning. My name is Veronica Gray. I am the Deputy CEO of Hourglass and Director of Policy for the charity, based in Northern Ireland. So it's lovely to hear another Northern Ireland accent on these webinars. It doesn't happen too often. So yes, really looking forward to this morning's conversation and to mark way out.
Thanks, Veronica. And for my part, I'm Richard. I'm the Chief Exec of Hourglass. For those who are unaware, which would seem unlikely as you've joined our webinar, Hourglass supports older people who have been abused and their families and professionals. We also undertake whistleblowing work in care homes. We were established back in 1993, so this is our 30th year in operation, and we have a remit across England, Scotland, Wales, and Northern Ireland. And we have the only 24/7 helpline for victim survivors of abuse for people and their families and professionals. So. Really interesting day for us today. Now, one of the things I wanted to kick off with was something I started off in the header, which was around why World Elder Abuse Awareness Day is so important, but also on the flip side of that, why is World Elder Abuse Day quite so underplayed in the UK, and also I think it's fair to say in Ireland as well. Veronica, do you want to kick us off with that?
Well, I think we can answer that in very short form, but it is more complex than that. The abuse of older people for far too long has been under the radar, and people have not been aware of it. 25 years ago, when I worked in child protection, people were reluctant to believe that abuse of children was really as wide scale as it was. As I have moved through my career, I certainly have noticed that same pattern and trajectory has been applied to abuse of older people. We still have people today. We know from Hourglass research in 2020 that a third of people across the UK don't believe domestic abuse affects people over the age of 65. So we have such a low level of public awareness. Our baseline is so low that we have a mountain to climb in terms of getting the awareness of the issue out there. And when we do engage with people and we do explore the issues and the nature and the scale of abuse of older people, they're shocked. They don't realise the severity of it. They don't realise that even non-physical violence against an older person can result in premature death. So we're talking about increased impacts of abuse. We also then have to consider that we have a real lack of policy in terms of older people and older people's invisibility in terms of legislation and policy. From a Northern Ireland perspective, we don't have safeguarding legislation, full stop. When we look to England, certainly Hourglass would be of the view that the Care Act doesn't go far enough in terms of supporting older people. And we look to Scotland with the Adult Support and Protection Act, which we view as robust, but what we're lacking is the data to prove that. So it's just not given the priority. Even as recently as this year, as Hourglass are working to produce what we're calling the Safer Aging Index, and I'm sure we'll talk about that a little bit later on. We're seeing that there isn't even data available in relation to the abuse of older people. So you can't fix a problem that you're not measuring, and yet the third sector are very much dealing with the problem on a day and daily basis. So I think there's lots of issues. So it's policy, legislation, lack of awareness. Obviously, we have a lack of media attention on the issue. I spoke to a journalist at one point who said her editor wouldn't run a piece around abuse of older people because it was just too sad. And why is that? Whenever we see stories of horrific child cruelty and animal cruelty all the time, it's not too sad to report on those, and it's absolutely right that we report on those. So why is the same not applied to our older people?
Thanks, that's really useful. Carrie, does Age UK, are Age UK in the same camp here?
It's a tricky one. As you know, Richard, this is a topic that I've been very, very passionate about for a very long time. And even at Age UK, which is a large charity with a large reach, it's been quite hard to generate interest there as well. And we are starting to see that. What we're seeing is, as we have started to raise our profile in this area, people are coming to us far more, and we're seeing an exponential increase in concerns coming to our charity. But something that Veronica said there, the media, whenever I'm asked to speak to media, whether it's a journalist in an article in a paper or something on the radio, I can guarantee that story will be dropped. More often than not, the story will be dropped because there will be something far more interesting in the media than the abuse of older people. And we really need the media to get behind us. But also, we also need to recognise that perpetrators are thriving in our society. But perpetrators, we need to not just focus on victim survivors. If victim survivors are ageing and perpetrators are thriving, perpetrators are aging too, and that's really uncomfortable, and a topic that often, particularly a charity for all older people, that's really uncomfortable, isn't it? And we've got to kind of start talking about these really uncomfortable topics and not shying away from them. The aging population is increasing and perpetrators are thriving. So we are heading for a disaster, basically. And we know, we're doing this every day. World Elder Abuse Day doesn't stop on one day for us. We're all really passionate about this topic, but there are a handful of people talking about this, and we need to galvanise support and get more people talking about it. But like Veronica said, awareness is one thing, but there's a real fine balance. If you don't have the data and you don't have the research to evidence the scale of the problem, awareness can actually be quite catastrophic. So it's a complex maze, isn't it, of issues that we need to tackle. At the moment, we only have 1 year's worth of data from the crime survey in England and Wales. So we've making a start, but as Veronica said, it's we're very early on in that journey.
Thanks, Carrie. Before we go over to Francis from a Northern Ireland perspective on this, Hannah, how seriously does the DAC office, Domestic Abuse Commissioner's Office, take the abuse of older people, bearing in mind your broad remit?
Yeah, of course, our remit is fairly broad, but Nicole's role is to champion the views and the experiences of all survivors and victims of domestic abuse. So, of course, this is something that we take hugely seriously. We know from Hourglass research that there's 1 in 5 people over the age of 60 who are experiencing some form of abuse or neglect, which is hugely, hugely significant. Obviously, this day is incredibly important in terms of shining a spotlight, but I think as both Veronica and Carrie have said, this is something that needs to be absolutely all year round, and we know that there are lots of really incredible specialist organisations that are doing that. So absolutely, this is something that Nicole wants to ensure is much more visible, and she'll be doing obviously work around this today, but it will be feeding through all of the work that we do. We've got work coming up on the criminal justice system, for example. We know that there's a set of very distinct and particular barriers that older people face when trying to access the criminal justice system. So that's something that we would be wanting to look at. We're actually doing a huge theme of work this year around domestic homicides and suicides, and we've commissioned Holt Research up at Manchester University to look specifically at themes of adult social care and health. And we know that those are themes which are hugely, hugely relevant to the experiences of older victims and survivors of domestic abuse. So this is definitely something that Nicole wants to very much improve visibility on and promote policy recommendations. Just reflecting, I mean, I would very much reflect what Veronica and Carrie have said about why this day is so important, and thinking about some of those barriers. We definitely share that view in terms of the lack of public visibility. This creates a huge, huge barrier, and is one of the reasons why this day is so important. It is very, very rare to see older victims and survivors of domestic abuse reflected in public narratives, and that's something that our office is very acutely aware of. That obviously has a huge impact, both in terms of service provision, but importantly in terms of policy making and who's at the forefront of people's minds when those decisions are being made. But it's obviously hugely important to victims and survivors in terms of them understanding themselves within that narrative and being able to recognise abuse. I think Carrie touched on this as well. And I remember when I very first started with the Domestic Abuse Commissioner back in 2020, one of the kind of conversations that I know that you will have all been doing lots of work around, but our office was also engaged in discussions with the ONS around the crime survey. And it was quite flabbergasting to me at the time that there was this upper age limit. So we weren't even capturing that data on the experiences of older victims and survivors of domestic abuse who were over the age of 74, which feels like a huge, huge omission. So it's great that we have that now, but it does mean that there's a huge amount that's been missing. I guess one of the other things, Richard, that I just wanted to flag was some of the work that Nicole has been doing over the last couple of years around mapping the provision of domestic abuse services, because there were some specific findings that came out there in terms of the experiences of older victims. And I think it's just a really, really important point to note. So we published our mapping research back in November last year. And what we found was that 55% of people over the age of 56 reported that it was quite or very difficult to access services. And that compared to 44% of victims and survivors aged 26 to 35. Now, 44% is a significant proportion as well. We're really interested in understanding why that jumps up so much for older victims and survivors of domestic abuse. And that was coming from a survey of over 4,000 victims and survivors. So probably one of the biggest surveys that we have out there at the moment. So we're really interested in exploring that in a bit more detail. So I think research, as Veronica mentioned, is absolutely critical in this area.
Indeed. Thanks, Hannah. What's the, actually, before we move on to Francis, just those who are out there watching, listening to this webinar, Hourglass had a meeting with the Safeguarding Minister not long ago, and one of her points was that the abuse of older people funding and profile is a historical anomaly, which was a really interesting phrase used. Be really interested to see those people that are listening and watching, perhaps on the chat facility that we have. What are people's ideas of sort of getting rid of that historical anomaly? What is it? What can we do to change people's perceptions? Francis, from a Nexus perspective, do people know where to go? Is elder abuse or the abuse of older people an issue for Nexus?
Yes, 100%. It's an issue for Nexus. And, you know, this day gives us an opportunity to focus in on those really hard to reach demographics. We can tell by our statistics that we only have 10% calls from people that are over the age of 55. And we know from studies, including BOWS in 2017, that you're more likely to be a victim of intimate partner abuse over the age of 61, as opposed to the under 60 age range. So I think in Northern Ireland, we're not reaching those that need our help, and we need to be looking at what those barriers are for them and how we can reach them so that they're getting the support that they need. But again, I think looking at it on a bigger picture, I think, you know, elder abuse is so important. It is a global social issue, and we need to be looking at this multifaceted response to make sure that the human rights of older people are protected. And
what kind of percentage of calls do you get from a Nexus perspective of older victims coming to you? Is it a big issue for Nexus?
It is, and it's something that we are very lucky to be moving forward with yourselves and working in partnership to try and address that situation. We are looking at about 10% of our callers, as I say, are the over 55 age range, which isn't great, you know, and we need to look at our campaigns, which we did last year with regards taking away those stereotypical images of younger victims and even younger perpetrators. So what we done was we used slogans that were recognizable to all demographics in order to try and reach that age range.
That's useful. Thanks very much, Francis. I think we've just had a couple of comments about the chat link not working properly. I'm sure Naeem, who's working for us in the background, is putting that right. So if you're trying to access the chat, just have a look. We're patiently putting it right in the background, I'm sure. The abuse of older people, Veronica, is the abuse of older people a growing problem? Are there stats that prove that there's a rise in this area?
Well, as has already been mentioned, we have a historical lack of data, and we're still in quite an unusual position where we don't have crime data in relation to older people who don't live in their own homes in the community. So any older person as a victim of a crime in a care home, for example, that data is not being captured. So we don't really have a lot of reliable historical information, unfortunately. But it is a growing problem. And we can say that in 2018, Hourglass dealt with 4,000 cases. And last year, we had over 30,000 impacts. So that is a huge growth in a very short period of time. And if we're seeing that dramatic increase, that can be reflective of what's going on in the community. We can also believe it is positive in that perhaps there is better awareness and more reporting. But it would seem to me that we are very much dealing with the tip of the iceberg. And as we have, and it's already been mentioned, we have an aging population, we have an aging demographic of perpetrators, which is absolutely right, Carrie. This is going to continue. This is an epidemic, and it is time that the global population woke up and realized, I mean, we all want to grow old. We all want to live full, healthy, safe lives. And I think that's why the Hourglass Safer Aging agenda as part of our wider work is so important. It is about talking to people today about what does your older age look like? What do you want it to look like? Are you prepared? Are you aware of what is potentially coming down the line with 1 in 5? I mean, that's a horrific statistic. I can name 10
over 60s in my immediate family, and I think that's 2 of them. And interestingly, we did have a comment in our chat earlier that I've replied to. We've had a school teacher wanting to join us today, who obviously wasn't able to and wants to see the recording. So I think that's really important. I think educating the next generation is absolutely vital. Our children today in schools are our next lawmakers, policy makers, social workers, lawyers, solicitors, judges. I mean, the criminal justice system plays a big role here. Our children in school today are our next journalists. They need to know that this is an issue. And that's the only way that we're going to really meaningfully start this conversation.
Thanks. Can I put another question out there, which would be really interested to hear, or other sort of perspectives on? Do we think that one of the issues that we have in the sort of elder abuse context is that it's seen as a niche area? Do you think there's that whilst there are such growing numbers, and with that 1 in 5 figure, do you think it's struggling for representation by being seen as something niche? Carrie, is that something that you'd like to pick up on?
Sorry, I was just looking at the chat there, so I completely missed that. I got really distracted. Can you repeat the question?
Of course, Carrie, for you, of course I will. I said that that is one of the issues that we're facing, that perhaps the abuse of older people is seen as a niche issue.
Yes, and it's an issue society doesn't really want to face. I think generally, we fade away as we get older. Many of us feel that. Even in midlife, you start to feel that invisibility. And I think it's not seen as a hot topic, is it? Anything related to older people often isn't seen as a hot topic, and abuse is also a really difficult topic. So you bring the two together, and often people don't want to think about it, people don't want to contemplate it. So yes, I do think it is a very, very niche topic. And certainly when I am ever asked what I do for a living, and I mention domestic abuse and older people in one sentence, I get is that even a thing?
Yeah.
What's that got to do with, how does that work? And I get that response every time I speak to anybody about that. So yeah, I do think it's very much a niche topic. Yeah. Older people are not a homogenous group. They represent every single one of us. And what does old mean? It means something different to everybody, doesn't it? And we know that there are certain groups who aren't seen, aren't heard in this space. And older people represent them. And it's really, the issue is just magnified because we do start to feel more invisible as we age often. And what I think is, when we think about perpetrators as they age, they're also invisible, but in a different way. They're thriving, but they're honing their craft. Often, abuse can escalate, but it can also become more invisible and much harder to spot. So yes, very much a niche subject. Thanks for repeating the question.
No problem at all. Francis, is it seen as a niche issue in NI as well?
Yeah, it is. And I think the problem in Northern Ireland is we have very cultural and generational, I suppose even religious ideals that older people have grew up and faced. So in Northern Ireland, we don't talk about our problems. Often we find the word shame used when people call our helpline. And I suppose maybe to give you a bit of context on a call, a couple of years back, we had an individual that had remained in a physically violent relationship for over 40 years. They only disclosed once their perpetrator had actually passed on because they didn't want to tell people about it. They didn't want to bring that shame onto their family. So they didn't, and they stuck that for all of that time. So if that cultural ideal is there and we're not talking about it, then nobody's picking up on the problems and they're not actually getting to the center of how do we fix it? I suppose.
Yeah, no, I think that's a very good point. Hannah, from a domestic abuse commissioner's perspective, with the growth in the usage of domestic abuse in different niche areas, we've seen work, for example, around the abuse of the migrant population, which have come, especially Afghanistan, for example, in recent years, the strategies around LGBTQ+ and so on. How does the abuse of older people with such a huge epidemic break out of the notion of being a niche?
No, absolutely. I mean, we've already reflected on this partly in terms of that issue of visibility. I think that makes the issue very niche in the sense that we don't hear as much from a kind of public comms perspective. And as I said, that really kind of impacts when we're thinking then about public policy making, but also how people are understanding themselves as both victims and survivors of domestic abuse. I think it's really, in terms of sort of breaking out of that niche, I think the situation that you kind of want to get to is making sure that public policymakers are talking about this lots and lots and lots, but they're also recognizing that there is a distinct response that is needed for older people that addresses those challenges, those barriers that we know that they're facing in terms of accessing services, but also to ensure that the specialist services are there. So you need that specialist distinct response, but absolutely agree that we need to make sure that it's not seen as a niche issue. And I think part of that, and you've touched on some other groups there, Richard, is making sure that when we're talking about a whole range of groups, we're talking about older people within those groups as well. Our office does a lot of work around the position of migrant survivors. It's about ensuring when we're talking about that group, we're talking about the experiences of older people within that too. And that applies for a whole range of groups. And I think that it's really important that, you know, we think about it like that, government think about it like that, in order to ensure that it's not a niche issue. And I think by doing that, that's where we'll get that public visibility as well. I was wondering actually, Richard, if I could just come back very quickly to that question around growth in this area and sort of the rise in numbers. And I can't speak in the same way as Veronica can in terms of the stats, but I think some of the areas that we've been concerned about might have led to greater barriers for people accessing services have firstly been around obviously the impact of COVID itself. So our office saw a huge shift within the domestic abuse sector over the last couple of years to adapt incredibly quickly to the sort of changing landscape in response to COVID. And that saw a lot of services moving online. A lot of that one-to-one support was done in that way as well, which was obviously, it had a lot of sort of positive outcomes in terms of ensuring people were still able to access support. But I think we have to recognise some of the digital barriers that is going to put up for older victims and survivors of domestic abuse. And that is one of the kind of more short-term factors where we're seeing an additional challenge potentially. I think the other thing just to flag is obviously the cost of living crisis as well. I know that from the conversations that we've had with Hourglass, from Hourglass research, that one of the most common forms of abuse among older people is economic abuse. In a cost of living crisis, that is only going to exacerbate that issue. And I think that's something that really needs to be made clear to government when we're having all of those conversations around cost of living, impact on survivors. What does that mean for older people within that context? How are they going to experience a potential rise in domestic abuse differently compared to other groups?
Veronica, do you want to come in on that?
Yes, I wouldn't mind just reflecting back, and I agree with so much of what Hannah has said. While the abuse of older people is potentially viewed as a niche issue, it shouldn't be. Because we're an aging population, we all want to grow old, we are all living longer and in many cases healthier lives, which should not be niche. And absolutely agree with Hannah that we need that specialist services support, and we also need the buy-in for support as well. But I do think that we often overlook one particular cohort of victims, and that's male victims. And with 40% of all Hourglass cases involving older male victims, and that figure just increasing, I think we need to have a dedicated space to discuss how we work with older men as victims. And I know I can say Hourglass are in the background as we speak, working around some of those issues. So that is when we're talking about niche groups and we're talking about marginalised groups. I would like us to also remember to include male victims. And in terms of the barriers, as Hannah has mentioned, yes, COVID had a significant impact, and we did at that time see calls to our helpline increase 30, 40, 50% in relation to some forms of abuse. And the cost of living crisis isn't going away anytime soon. And we are certainly seeing older people living in poverty coming to us. But as financial abuse, I think 66 or 69% of all our calls last year in Hourglass related to financial or economic abuse. That is really an epidemic. We need to be extremely mindful around that issue. And often when people come to use Hourglass services, they will use financial abuse or economic abuse as the gateway. We often find that victims find it easier to say they're being financially abused than they're being physically or psychologically abused, neglected, or sexually abused. And I think that's okay, and that's what we do, and we deal with all of that. But, and again, we look back to Hourglass' own research from 2020, when 1/3 of the United Kingdom population don't believe that taking money from an older person's bank account without permission, or taking precious items from an older person's home without permission is abuse, then again, we're back to the need for awareness raising, the need for policy, the need for legislation, the need for the criminal justice system to prosecute. I mean, I was involved with a case a few years ago in Northern Ireland where a niece stole, well, she was convicted of stealing £12,000 from her elderly aunt. And in reality, the figure was probably much more. She was convicted, she went to court. The judge imposed a 6-month suspended sentence and ordered her to pay £500 victim compensation. Now, there is no justice in that scenario whatsoever for the victim. And there's no accountability for the perpetrator. And I think that's something that we need to look at. And again, when that story came into the public domain, this story was in the newspapers, there's no deterrent to the general public. In fact, someone said to me after reading the story, when it comes to older people, crime really does pay. And we need to start addressing that.
Let's look at some of these messages that have come in. Carolyn McDowell who is a PhD student at Queen's University Belfast, researching domestic abuse among older women in NI. And that question has, of course, just skipped up. There we go. Amongst older women in NI and the barriers they face in the criminal justice system. There are some academic papers that might be useful when thinking about the needs of these women. So she's mentioning Hannah Bowes, who we know well, and Kevin Brown, likewise from Queen's University Belfast. Good time probably to mention Hourglass's Knowledge Bank, which has this type of information on it as well. So if anybody's interested in looking at more research-based information. Hannah, we have a few questions for you, but we'll come back to them. Tina Walker mentions that we've seen specialist services in domestic abuse service asking question for a perfect victim or perp dynamic that doesn't fit older people. For example, does he text or email all the time? Looking for online abuse. I think that's a really interesting point. Makes perfect sense. Likewise, Eleanor Marsh mentions that Hourglass operates a specialist older persons IDFA service across Sussex, commissioned by PCC. Well, look, it just sounds like we're blowing our own trumpet now. They are doing fantastic work to raise the awareness of this issue and the important partnership working with our commissioned domestic abuse and refuge services and other specialist providers. Very pleased to have them in the area. We're delighted to be in the area, but we need more IDFAs across the rest of the UK. but if we work in partnership, everything is possible. Paula Lathan says that she works for a local small charity supporting victims. They've seen a big increase in the last 2 years. Carrie's pushing her blog, which we can, what's this, knowyourplace.uk, which is focusing on older women. Ruth from the Buckinghamshire Domestic Abuse Partnership are rolling out Hourglass training, which are really good, really pleased to hear. And a comment from Tony, who mentions that rights and capacity issues are not clearly stated in easy to understand formats for both the elderly and their carers and supporters. Read criminality. We need to create a message around supporting the weakest in society, those young, old, and with additional needs. Rosie asked an interesting question, which we're going to come back to, which is, what does the panel think about creating a new strategy focused on this area? And would it help raise awareness? You are preempting a question which is coming very soon, Rosie. Question for Hannah. We will try not to throw too many questions at Hannah. Whilst ONS are collecting data of those over 75, I think that's the England and Wales Crime Survey data, over 75, most of this is not disaggregated in terms of the data that is publicly available. So, for example, it's not possible to access specific info about gender, partner abuse, domestic abuse, or domestic sexual, or even family abuse is restricted. I have queried this and been told that it's for reasons of confidentiality, i.e. numbers are too small and there is the risk of de-anonymization. Whilst I understand it's not helpful in terms of trying to develop knowledge and understanding, let alone research in this area, is there something that might be done about this from the Domestic Abuse Commissioner's Office?
Well, I'd be really interested, Richard, if you're able, because I'm doing this on my phone, if you're able to send me that information, because it's something we could definitely follow up on, and I can have a chat with our head of research, because obviously they do lots of work with the ONS around this particular survey. And as I'm sure you can imagine, as an office, we're always looking for data to be disaggregated so that we can come to sort of more firm conclusions. So I definitely be interested in following up on that. It sounds like a very sensible way of breaking the data. We often come up against that issue on a range of different topics when it comes to very small sample sizes, and the potential, if you're kind of breaking it down even further, to de-anonymize the data. That is an issue that we come up against quite a lot. I guess our response to the ONS on that would be, well, let's just get a bigger sample size. Let's make sure that we have a big enough sample size in order to disaggregate the data in a way that is genuinely helpful policymakers. But yeah, I'd be really interested if someone's able to copy that over to me, just because I'm on my phone. I'd be really interested in taking that back to our head of research.
Okay, that's really useful. So that came from somebody called Bridget. Bridget, Hourglass are also very keen to look very closely at this type of research. And it's Hourglass's research which is featured on some of the WHO pages on Wikipedia and so on and so forth. So we're very keen to keep that link going. So do come to us direct if we can help more, as well as I know Hannah's the team at DAC would be very keen to do likewise. Amanda makes a very good point. We know Amanda well, who don't know that there is an older person's DASH risk assessment in Cambridgeshire for use with victim survivors aged 60+, and we're happy to share with others. And Amanda has offered her email address. We can only sort of offer positives about that approach in terms of the DASH risk assessment. Very difficult to say in Cambridgeshire. Look, we've touched on this subject. We've got another couple of points here, but we can come back to them. The other point, the question I would like to throw out now is, do you agree, do we think that the UK needs a violence against older persons or older people strategy? Should we start with Francis? Does NI need a violence against older people strategy, and how would that work from a UK context as well?
I think from our perspective, we would support any initiative that is protective of all forms of abuse, and that includes an older people strategy in the UK. 13% of our calls on our helpline in Northern Ireland come directly from mainland UK. In a Northern Ireland context, we would actually also call for the final domestic and sexual abuse strategy to be all encompassing and reflective of the needs of older people. We have recently responded and give our views on that. I think a strategy needs to include forms of abuse that aren't just intimate partner or familiar. So a older person strategy needs to be there. We need to look at care abuse, we need to look at institutional, we need to look at age exploitation and even violence perpetrated by scammers. I think another point that I want to go back to that Veronica mentioned was the need for males to be recognised. 25% of our callers as well are male victims, but in Northern Ireland we have great services. We have our PACE project, which is specifically for males, which has just been launched, and we have the Men's Advisory Project here in Northern Ireland as well that do fantastic work, but a lot of the service aren't for those in crisis, and we don't have male refuges like you would have on mainland UK. So there is also a big lack of research for male victims, especially older male victims in Northern Ireland. Queen's recently released a paper that showed that when it comes to males, Northern Ireland actually has no research at all. And we had to look at other countries as to see how we start a men's strategy as well. And that has already formed, and there is groups and charities that have came together to put forward the needs of male victims.
It's really interesting. Thank you. Carrie, violence against older persons strategy.
Yeah, absolutely. We need a really clear plan, clear strategy on how to tackle this, because if we're not careful, we are going to raise awareness without a clear strategy in place. And, you know, to have specialist services, we need evidence, we need research, we need data. And what we need to be careful of is if we are raising awareness and older people do start to recognise that some of that insidious abuse that they're experiencing, whatever that might look and feel like, if they do reach out and the door is shut and there isn't the service there to meet that need, they may never reach out again. And this is a generation of people that may have reached out previously when the law was different, when there weren't services, and were told to just get on with it, that was normal. So we've got to be really, really careful that we don't kind of run before we can walk here. And that's why a strategy will hopefully really pull that together. And some of the comments in the chat, I've noticed capacity being brought up, safeguarding inquiries, and I'm more than happy to answer some of those questions. But it's so complex in this arena because, as I said, older people represent us all. So these factors really need to look clearly at that strategy and where there are particular pinch points where we're not picking up data and research, so that we can move forward and get this right, not pay lip service to this topic, which I think is, you know, there can be a risk of that, can't there, if we're not careful.
Agree. Hannah, this is something we discussed with Nicole when we met her recently. What's the Domestic Abuse Commissioner's Office sort of perspective on a violence against older persons strategy or framework?
Yeah, so you'll know if you met Nicole recently that she's supportive of that call for a dedicated strategy. I guess what I would say about that is that in order to be impactful, probably a successful strategy in this area would need to sit across government. We want it to be a fairly wide strategy, so we would see domestic abuse sitting alongside other forms of abuse, in part because we know the definition of domestic abuse in the Domestic Abuse Act doesn't cover all forms of abuse that would be likely to be experienced by older victims and survivors. So I'm thinking specifically there about potentially abuse from a paid carer or a neighbour. So I think just really, really important that we see it within that wider context, and domestic abuse obviously would need to form part of that strategy. As I mentioned, I think that importance of sitting cross-government would be really important, and that is the benefit of having a strategy or a plan that sits with government, that you can insist on it sort of sitting across a few departments. I think particularly when we're thinking about older victims and survivors, the role of health, the Department for Health and Social Care is obviously hugely, hugely important. We wouldn't want this to just be something that was kind of sitting with the Home Office. We would need that kind of cross-government input. in terms of what we'd really want to see reflected in there. And again, this reflects the sort of importance of cross-government working. I know that Nicole would, and I'm sure she mentioned this in the discussions that she had with you, want to emphasise that importance of a coordinated community response to preventing and tackling domestic abuse. So for people that aren't as familiar with the CCR, what we're referring to there is a model whereby a range of public agencies are skilled and trained to prevent and spot the signs of domestic abuse. And we're expecting that those services would be trained by specialist domestic abuse services, and that they're linking them through with those services as well. So that's sort of how we would like to see it framed, how we would want to see domestic abuse situated. But yes, we would be supportive of a strategy.
Veronica.
Well, I think probably most of the key points have been covered there. Obviously, Hourglass believe that a violence against older person strategy is absolutely crucial, and we really can't continue to sleepwalk into an ever-increasing crisis. I think really, to reflect what has already been said, we need to address the unique challenges faced by older victims, and that includes older people as victims of domestic abuse, and as Hannah has said, older people as victims of abuse as an older person, which don't fall under the banner of domestic abuse. And I think we need to be clear about the differences on that. And I think that's where, you know, Hannah gave the example of care workers. That's where we need to engage with the regulators, the professional bodies, social care providers. I mean, the scope and need for collaboration is massive. And I don't think that this is going to be an easy piece of work, but I think it's an essential piece of work. I think we also need to involve stakeholders across every level of government, but also every level of community. We need to look to housing providers. I've just been watching the chat. Apologies, I drifted into reading that. The provision for male refuge in Britain is poor. It's non-existent in Northern Ireland, but it's poor elsewhere. And someone has just said very often male victims end up sleeping in their car and becoming homeless. So we need to look at that. So we need to involve housing here and say, look, what can you do? We need to involve communities from a very grassroots level. We need to involve education. We need to join our efforts. We all have a piece to offer this jigsaw puzzle, but we need to commit the will to do it. And I absolutely agree with what Carrie said. If we want to increase recognition and we want to increase reporting, then we have to have the services available on the other side. And we, as charities sitting around this table, we know how difficult and challenging that is for us. And it's lovely to see the comments coming into the chat about our IDFA work in England. And yes, of course, we would love to wave a magic wand and have that available everywhere, because provision for older victims should not be a postcode lottery dependent on a particular local authority or PCC being aware and in tune with the issue of abuse of older people. So those are all of the things, and I think in the Victims and Prisoners Bill, the duty to collaborate that we're talking about, I think all of those things, we're making very small steps in progress, but the overarching strategy, I think, would certainly help bring all of the strands together.
Just taking my chairman's hat off for a second, not that I've had it on very firmly anyway throughout this call, but how do we do that when there are some organisations that already have the whip hand in this area and are not that keen to collaborate? How do we ensure that that duty of collaboration, especially when you are already an industry leader and invited to every committee, every cross-party group, and have sort of tentacles in every useful group across the UK? How do you enforce that duty? As a representative of one of the larger charities, Carrie, and that wasn't aimed at Age UK at all, as you know, it really wasn't. How do we do that? How do we get larger charities and larger bodies to collaborate? I mean, you seem to have done well with Age UK.
It's a really good question. It's still an ongoing challenge. I'm not going to be dishonest. I'm not sure. I would be really interested in the chat what people think. You know, this is something that I've battled on with grit and determination for years and years and years. I've got louder, I've got bolder, I've got a bit less fearless, and shouldn't have to be that way. And I really don't know the answer. It's a tough question.
You've disappointed me, Carrie. I thought you'd come out with a gem there, but no, I'm joking. You're right. It's a really tough one. But I mean, it's really difficult. We don't all have the same access as Women's Aid. So how do we ensure that everyone is represented around the table? Hannah, what's your take on collaboration, the more broader subject area?
Yeah, well, I was actually going to touch very quickly, Richard, on the very specific duty to collaborate that we have in the Victims Bill, because obviously that is something that we're hugely supportive of as an office, but we do think that there are a number of further steps that need to be taken and sort of strengthened around that duty in order to make sure that collaboration works in practice. And these are going to sound like quite high level policy things, but we do think that they are important in terms of how this all plays out on the ground and how partners are able to deliver. So the first issue is around amending the legislation to require those partners to actually conduct a joint needs assessment. So at the moment, we can have a duty to collaborate where everyone sits around and plans things, but what we absolutely need to know, and again, this is something that Veronica has touched upon, is exactly who our populations are when we're talking about who experiences domestic abuse, and that those strategic needs assessments are detailed enough to tell us what's out there, who needs help and what they need. So that feels like a really, really crucial element of making sure that any duty to collaborate is going to be really meaningful and is going to work for a whole range of different groups of victims and survivors. The next thing that we think is really, really important to ensuring that this all works as it should do, and this is going to sound really obvious, is to make sure that the money is actually there. And really, really important when we're talking about some of those smaller specialist organisations as well, who might not have the funding to provide those kinds of services that we know victims and survivors want and we know are really, really critically important. So the other element of the bill that we're focusing on is having a duty on national government to make sure that the funding is flowing to local partners to ensure that we can actually deliver properly on that duty to collaborate. So knowing who we're talking about, knowing what they need and they want, and making sure that we have the funding for all types of agencies, including those specialist support services that we know play such a critical role in all of this.
It's really useful. Before I come to you, Veronica, collaboration, you touched on it earlier, Francis. There seems to be some good work on collaboration from an NI perspective.
There's a lot of good work going on in Northern Ireland in lots of different areas. We have our domestic violence partnerships in all of our trust areas. We have our female strategy. We have our male strategy that is now being looked at. We don't have an older people strategy, so it's something that I think we still need to be pushing for. We still have the problem where organisations, I feel, very much can be pitted against each other for tenders, where maybe they could be slightly better, where there is multiple agencies that are doing the same work. Is there collaboration there? Can we join those up so that those tenders can be looked at together as opposed to going in competition? Because that does break down the relationships, I suppose, as such at times as well.
It's really interesting, Francis. Thank you. Veronica, collaboration.
Yeah, I agree with actually everything that's been said. But I think then, and I'm very much with Francis, and she's saying it, but I know exactly what she's referring to, and that pitting organisations against each other, especially somewhere as small as Northern Ireland, is actually really detrimental, because in a small country, in a small place, every other charity is your competitor, regardless of what their subject area is, because we're all pitting for the same funding. So it is difficult. But I think also we have found ourselves where and Richard, you've alluded to this, the longer established and the better resourced charities have the voice of government, and therefore have an open door all of the time, whereas organisations like Hourglass are constantly having to batter that door down. And I think that there isn't a level playing field in terms of charities having the ear of government to represent, and I think that is so wrong, because all we're here to do is represent our beneficiaries. It's not for your benefit or my benefit. This is for 82-year-old John who's being made homeless because his son keeps beating him up and he just can't deal with it anymore. So yes, we need to dismantle the monopolisation that goes on in terms of the charity sector, and we need to continually appeal to government to take the issue seriously, because right now many of them aren't.
So therefore, we've discussed collaboration, we've discussed perhaps representation at that level. Going back to the day-to-day and going back to the notion of a violence against older persons strategy or agenda, what are the barriers there? And I'm not talking about representation and collaboration. What are the barriers in terms of policy? What have we got to get through to make a strategy like this work? I know that there was the same barriers in the past with child abuse, Veronica.
Yes, there was, and I think government should be congratulated in learning those lessons, and in terms of implementing a violence against women strategy and dedicating those ring-fence funds towards implementation of that. I think lessons have been learned and there's been excellent progress made. Not perfect, but good progress. So I think we can learn from that. I would be concerned that one of the first barriers we're going to face will be fragmented policy and legislation across the UK, because we're not starting from an equal level, and so it'll be hard to determine our baseline. I think that will be one of the key issues, because there's inconsistencies, there's gaps, there's lack of data, there's lack of research, and those are the foundations of good strategy. I think another issue is basically ageism, and I think and I know lots of organisations are doing lots of good work, and I think it is part of Hourglass's remit to talk about this. Negative attitudes about aging and older people become the breeding ground for negative behaviours towards older people. So I think we need to talk about that, and we need to really understand why. For example, in our own research, we found that when we asked people to think about abuse, 20% of people automatically thought about animals, and only 7% thought about older people. And we need to ask those questions. I think that will be a challenge. Addressing the ageist attitudes to get this strategy right will be an issue.
Carrie, barriers from a strategy perspective.
We've covered a lot of them already. I actually think, and like I said before, we've not got the data, we've not got the research to back up what I'm about to say, but anecdotally, I've been working with older people for the last 25 years. And I think one of the biggest barriers is volume, the scale of this problem. Once we start to really unpack it and start to see what's really going on out there and what's happening, whether that's current or the impact of trauma, the trauma related to the abuse of older people, people that are now safe. You know, the abuse doesn't stop, the trauma doesn't end. I think the scale of the problem is huge, and the impact of that is going to cost a lot of money. Older people are aging, we know the population is aging. I think once we start to open that Pandora's box, that will be a huge barrier in taking this strategy forward.
Are there lessons that the Domestic Abuse Commissioner's Office have learnt from, for example, rolling out some of the strategies you've worked on, Hannah, and from a VORG perspective as well?
I mean, I would say there's absolutely always lessons to be learned in terms of the way in which government are rolling out various strategies. I mean, I think sort of just taking it back to its base and thinking about lessons learned and challenges that are kind of very obvious one. So I agree with everything that Veronica and Carrie said there, but the very sort of obvious first challenge is actually getting your strategy in the first place. And that's obviously very, very dependent on government capacity and funding. So making that case for change very, very clear. We know we could have a general election as soon as December 2024. So we're slightly running out of time. So I think it's about thinking about this in both the short and the long term in terms of how that's being pitched and what you want from a government now and then what you want from the next government, I think is really clear. Because I think what you don't want to end up with is a very, very short-term strategy. I think strategies are good when they have that combination of both sort of long-term planning to get the real structural change you need alongside some of those short-term interventions that are going to make a change in people's lives right now. So I think it's probably just the challenge of how you land that within the political cycle that we find ourselves. I think the other thing, just thinking about other strategies that we sort of currently have out there, and I think this will be really, really important when it comes to older victims and survivors of domestic abuse. And something that we've touched upon a lot in this session is that it doesn't feel like it would work if it's just about the provision of services and policy making. It will have to be accompanied by an extremely strong communications campaign. We have to send a really, really clear message to people that they are seen and that they are heard and that their experiences are valid and they are victims of domestic abuse. That absolutely has to be part of this. Without that, I don't think you'll reach all of the people that need to be reached via this strategy. That feels really, really important. It feels like you have to be able to address through the comms campaign some of the really, really significant barriers and distinct barriers that older people face. And I think Francis mentioned this, I think others mentioned this about those kind of societal norms, that if you're someone that grew up for the majority of your lifetime, you know, knowing that rape within marriage was not a criminal offence, to shift that thing, you know, this is something that needs a huge amount of work in order to make people feel comfortable and safe accessing services, and recognising themselves in that position. So those are the two things that I would say in terms of lessons learned from other strategies. Oh, Richard, I'm sorry, I think you might be on mute.
I am indeed. We are based on a park which has a motorcycle shop nearby, and I think they were having a competition for how loud they could be. But so before we move to Francis, just Irene Richards on the chat here responded to that question. Yes, once you embark on a strategy as suggested, quickly said and agreed, but hugely difficult to draw up and implement. The more you do, the more you do. And the scope of such a strategy expands into more and more areas. Our society is multifaceted, multicultural and diverse, and will require vast resources which are not available with so many competing demands. This is not to say that an attempt shouldn't be made, but realistically, I'm feeling pessimistic. My comments arise from a very long experience of safeguarding where, from the early days of No Secrets, I've seen safeguarding expand into areas that hadn't even been thought of. Indeed, domestic abuse has expanded into so many areas that are now considered as abuse. That's a really good point, Irene. Thank you very much. Francis, barriers from your perspective.
Okay, so this is really frustrating, and everybody in Northern Ireland is feeling our frustrations with the clear barrier that we have in the form of a non-sitting executive. We have multiple strategies and legislations already drafted that are basically gathering dust until our MLAs reconvene in Stormont. And this further impacts then on our waiting lists, our funding, you know, and the impact on making sure that those specific effective services are available. But I think as well, Veronica had mentioned earlier, there was limited research. And I think research can be a big barrier sometimes. We hear a lot from older callers on our helpline about coercive control. And if we look at the really fantastic research Evan Stark done, that research was there from the 70s. We're only implementing the legislation on that now. So when you look at the lack of research, even in your crime research in England and Wales, it excludes the considerations for the over 60s. So if that research is there, how long is it going to take for this strategy to actually be implemented?
It's a very good point. A very good point. We'll come back on that in a second. Now, it's now just coming up to 11:10. If anybody who's listening wants to ask any questions, then please put them on the chat now. I know that the panelists, there's been a lot of positives that's come from the chat around this particular session, so thank you to everybody. But particular reference to Natalie Thomas, who's been on asking a few questions, but mentions that she's a global cross-sector worker, consultant, student and volunteer, also an advocate and activist that ceaselessly lobbies the global governments. I see so many correlations, but little or no or biased research being done. I trained in specialist engagement and comms to effectively engage in solutions, R&D, and these implementation of these strategies programs from the grassroots and upwards. One takeaway point from that comment, and there's a few others, is this is actually a global problem. This isn't just a UK problem. Whilst it's interesting to see that, for example, in America, some states in America and in New Zealand and in Canada, elder abuse is actually a crime in its own right. And it's something that our previous chief exec at Action on Elder Abuse was pushed very hard around the crime of elder abuse. We are now looking at strategies around safer aging, and there is a global strategy taking place at the moment about age-friendly cities. So there is lots going on at a much, much bigger level. Just useful to make that point. We haven't had many questions come in since I said that, but I'll give it another moment. Eleanor has come back and asked, Hannah, could you repeat what you said about the research that DAC office is doing on DHRs with HALT? I think that's probably a point that they're making.
Yeah, so Eleanor, just for background, one of the things that our office is currently in the process of doing is setting up an oversight mechanism where we're going to collect all domestic homicide reviews so that we can essentially ensure that the lessons are being learned in order to prevent future deaths. So that we're working with kind of national policy stakeholders, but also working at a local level to ensure that the actions that are coming out of those domestic homicide reviews are followed through. Whilst we're setting up that mechanism, one of the things that we've done is commission HALT research up at University of Manchester to look specifically at some of the key themes that we know come up in these domestic homicide reviews. Two of those themes were adult social care and health. And we know that the experiences of older victims are coming through very strongly in both of those reports. We haven't seen the final version yet. We're aiming to publish those this summer, but we feel that it could be really, really beneficial in terms of this work and it's understanding the experiences of older people. And I should have said, HALT Research up in Manchester essentially they've done loads and loads of work to collect a huge body of these domestic homicide reviews. So that's why we were working with them in order to do this analysis.
Great, thank you so much. Question from Sam. Do you have any resources or recommendation for working with older people where they lack capacity, where there is also caring responsibilities involved that you can share? For example, we see cases of domestic abuse involving someone with dementia being abusive to their older partner, but there seems to be very little research or information around how best to support in these cases. Veronica, is that something that you know, have any background on, or anybody else?
I have come across documents in the past. In the first instance, would say possibly check our knowledge bank. Have a look on there. You might find the resource you're looking for. But if you wouldn't mind putting your details into the chat, that's certainly something that we can easily find for you and send over apologies. It's just not coming to mind straight away.
Okay, no problem at all. Anything from you, Francis, around that question around where there are older people who lack capacity?
I know Dementia NI has some resources on their website that will cover how do we respond to that, and dementia, the brain, and even sexuality. I don't know if it's maybe as in-depth as what they're looking, but it is a place to start.
Carrie?
Yeah, I've just put something in the chat. The SOS toolkit for older survivors, which it's from Solace Women's Aid, but actually it's really useful for both genders, is quite a useful toolkit. But yeah, what we're seeing, and historically what I've seen, is capacity and consent often really misunderstood and used as a barrier, and a real lack of understanding from professionals, particularly in the social care space. And I have come from that space, so I speak with experience. Is often used as a reason not to intervene, and there's a real lack of understanding around coercive control and the impact on decision making, and the ability for victim survivors to recognise that their decision making is being impacted. And often, particularly with older people, there's this kind of excuse used not to intervene because that person has capacity and therefore can make an informed decision. But if you're being controlled and coerced, can you really make an informed decision?
Okay, thank you very much. Eleanor's mentioned also important to think about other barriers faced by older LGBTQ+ and Black minority ethnic victim survivors. Absolutely, that's a good point and well made. Thank you. Amanda's mentioned developing a, I think that says e-learning, or no, learning, sorry, around, I wasn't getting at your spelling there, Amanda, apologies, around domestic abuse and dementia. There's a really useful link there. Carrie's put the SOS toolkit on there around Solace Women's Aid. Likewise, there's a comment here from MJ. I feel current safeguarding with making it personal has a terrible blind spot of people who are psychologically abused, which is usually combined with other types of abuse. I think we'd all agree with that completely. Just one more here. Oh, I think I've mentioned that already. Yeah, I think I mentioned the Google Scholar research engine that Natalie has pointed out. Lots of data to be sifted through, and then complement the current data. I think she's referring to the knowledge bank there, and help you to progress and develop further research and strategy and implementation. Totally, good point, Natalie. Now we're coming to. Oh no, we've got some more messages. Sorry, this is
to navigate, isn't it?
It is. Cambridge and Peterborough have a domestic abuse dementia sway, which has been listed. So somebody's asked a question. Danielle McCann, is there any case law of elder victims of domestic abuse who have continued to live with their perpetrator during them having capacity, and when the capacity lacks, they voice what they want to return home with the perpetrator? As Carrie said, it can be a complex issue when looking at capacity or coercion. I mean, that's something that we deal with quite a lot, from what I understand, Veronica.
Yeah, sorry, I found cut out just briefly and I missed it. I was scrambling to find the question. Can you repeat?
Case law around elder victims of domestic abuse who have continued to live with their perpetrator. I think we've had issues where not only do they continue to live with them, but also they suffer the continued abuse because they are worried about losing that care. Because there's nobody else, and often it's a member of family. That's probably one of the issues. Veronica, is that
would be the biggest issue, really, that we would see. And again, then whenever you come into, as Carrie has said, when you come into that situation, and the intervention is, well, the individual has capacity, they've made their decision, and they choose to remain, because we need to address what the alternative is. Where does that,
why should a victim have to leave their own home, maybe a home that they've lived in for all of their life? Who is there to support their care needs? Who is there to, in some cases, provide their social contact? So we have to address that. What's the alternative? And I think we're in a really bad place when we're saying that there is no alternatives here, and older people feel that living with an abuser is better than what? As we've seen in the chat earlier on, older male victims being made homeless. We do know that there is a proportion of older women in refuge in Northern Ireland. But there is also, I don't have the link right now, but I will be able to find it. There's a video about an older woman talking about her experience of living in refuge. And she actually, it was quite an interesting scenario. She was living with her daughter and son-in-law, and the domestic violence was between them, but she just couldn't deal with living there anymore, and she went into refuge after her daughter then started turning violent on her. And she talked about how she couldn't sleep at night because she could hear the babies crying. And I thought that was just really powerful. She was concerned about these small children and babies living in refuge and what they were going through. And she talked less about what she was going through. But at the end of the day, that woman still had to flee her home with literally just the clothes on her back. And she's possibly one of the lucky ones. So we need to come up with better alternatives, and perpetrator programs and perpetrator strategies and safe havens and all of those issues. There's so much to talk about.
I think I'm right in saying, somebody might correct me, that there is a specialist older man's refuge. I think it's in Dudley, although I could be wrong. I think we met the chief exec of that at the Domestic Abuse Commissioners Festival of Practice. There's quite a lot of, it's quite a rare resource, but if anyone has any more information on that, perhaps they could put it on the chat before we finish. We've had a message from Bridget Penhale, who, ironically, Bridget, we've actually been trying to get hold of you because you are one of the founders of Action on Elder Abuse, and us being 30 years old, it'd be very good to make contact with you again. But she's mentioned that she'd be very keen to have contact from members of the panel, DA's office, if her background as a practitioner, manager and academic would be helpful. It certainly would, Bridget. So before we begin the wind up, I would like to ask each of the panel members to come up with one item that they would like to see included in a violence against older persons strategy or framework. Doesn't need to be necessarily a strategy. What one thing would you see would need to be committed to this type of document? I don't know who to pick on first here. Hannah, I suppose I should pick on you, really.
Thanks, Richard. I feel like there's so much that we would obviously want to see in there. And I know I mentioned about the coordinated community response being incredibly important. But I guess if I feel about one thing, and because I'll let other people go sort of more into the detail on the policy side, it would be that really, really strong communications campaign. Okay,
absolutely. As a former journalist, I can't agree more with that. Carrie.
Oh, it's really tricky to pick one. I'm going to say focusing on perpetrators and holding them to account, shining a light on perpetrators.
Okay. And what sort of impact do you think that would have?
I think perpetrators of abuse, of all forms of abuse, but particularly as people age, because those perpetrators are basically anybody. They are sons, they are daughters, they are siblings, they are grandchildren, they are intimate partners. I think we need to shine a light that perpetrators are everywhere. They walk amongst us, they don't look a certain way. Equally, victims and survivors don't look a certain way. Any one of us can be affected. And I think that's how we galvanise awareness, that we start to see it for what it is and don't other victims and don't other perpetrators. And that is where we might start to generate some of that interest and some of that passion on this topic. And also recognising each and every one of us in this virtual room could be a victim survivor one day. And equally, each and every one of us could be a perpetrator.
What one thing, Francis, would be useful for Nexus in a violence against older people strategy?
I think for us, it is early intervention and prevention, safeguarding the next generation of older people coming along.
Very concisely put. Again, I think everybody in this chat would agree with that. Veronica.
Francis stole my one. Completely agree. So my other one, which is, I would like to see data and research. I think mechanisms to collect the data, including prevalence, risk factors, outcomes, is absolutely essential. That has to be our starting point. I'd like to see research initiatives to better understand the underlying causes and what the effective interventions are and what those outcomes are once we take that older victims through our journey to recovery and moving on. What does that look like as well? I mean, ultimately, we need to have effective ways of monitoring progress and what is working in terms of intervention, and then be able to share that possibly at a global scale.
Apologies if I pronounce this incorrectly, but Anne has come back to us and suggested the education of everyone, rather like what we do with young children, should be front and center of this. And I would, of course, put in that there needs to be a funding structure. I think Hannah's made this point already about needing the funds to make this work. I think it's worth saying that somebody mentioned that mental health is a Cinderella service, which I think is a fantastic description. But the abuse of older people hasn't even got up to Cinderella levels yet. And the comparison in terms of funding, I think Veronica used the analogy of the abuse of animals. We receive significantly less funding than charities focused on that. Most charities that have a function around the abuse of older people are living hand to mouth at the moment. So I would urge strongly that any kind of strategy would involve realistic and sustainable funding in the same way as other forms of abuse. And I would also urge those at the Home Office, for example, to look at those lifeline payments that went out via Women's Aid not that long ago. That was a fabulous idea, but the chances of men and older men, particularly going through Women's Aid for that type of money, is almost nil, I would suggest. So we probably need to look at ways of getting lifeline payments out during these most difficult times across other organisations and not just those connected to one charity. So I would put that into the mix. And that comes from representation and collaboration again. Carrie's mentioned the huge overlap with mental health and the impact of abuse. Eleanor has asked Veronica, when will the Safer Ageing Index 22 for England be published? And as someone who knows that you were working on it at 2 o'clock in the morning the other day, do you want to give us some data on that?
All I'm going to say is watch this space over the next 2 weeks, where we I have the Greater London Safer Ageing Index sitting on my desk right now. So we're getting very close to publishing that, and we're phasing the rest of the regions of England across the remainder of the year. So to keep on top of that, make sure and sign up to our newsletter and follow our socials, because all of our information goes out in that format. Or Eleanor, drop me an email. I can't reply to the chat because it's only just going to our host. It's not going back to delegates. So feel free just to drop me a message.
Also worth pointing out that the Safer Ageing Index for Wales isn't far away either. That's, I think, it's probably late summer or something like that, but so that's not far away. Interesting point from Natalie: knowledge does not have to cost. Economically, status quo systems and processes are the issue. I ensure free educational resource access to many. It costs me my time and energy, very little economically beyond my usual energy bill. Veronica.
If I think that was Natalie had that comment about
Yeah.
educational resources. And we would be very happy to host your information on our knowledge bank if you'd like to send that through to us to make it more accessible. We had about 16,000 people use the knowledge bank last year, so it's a good audience.
Fantastic. We are close to winding up, but I want to give Francis the opportunity to talk to people about how they can get hold of Nexus in Northern Ireland. So I know I didn't do that at the start, so apologies for that. How can people get hold of you?
So obviously our helpline is 24/7. You can contact it on 0808 802 1414. We also have a web chat and email service for anybody living in Northern Ireland. We also provide specialist counselling around sexual abuse for the ages of 4 right up to adulthood. That always makes me sad given that age. And we have our male domestic abuse project that anybody from the age of 18 that identifies as male at the point of referral can access if they have been affected by domestic abuse in all contexts.
Carrie, how can people reach Age UK?
Age UK have an advice line. We're open 7 days a week, 8 till 7. The telephone number is 0800 678 1602. But I must stress, Age UK are not the specialists here in abuse and domestic abuse. We have lots of resources, but we will signpost to Hourglass, and we have a collaboration with you, so we can internally refer as well. But we do have lots of resources and fact sheets on this topic.
Veronica, how can people get hold of Hourglass?
Through the helpline 0808 818 8141, which is free phone, confidential, number doesn't appear in a bill, and is 24/7. Or go online. We are hourglass.org, and you will find our instant message service, our chatbot, our knowledge bank, and details of our free SMS and our email helpline service as well.
And you have a wealth of information on your website, Hannah.
Sorry, just unmuting there, Richard. Yeah, there's lots of information on our website. I would say that we're not the people to go to necessarily if you're looking for support. There are lots of specialist organisations that would do that a lot better than us. We also are not allowed to intervene in the cases of individuals. So just to make that really clear, one of the things that I have just posted in the chat, but I think maybe it only went to you and other panelists, is the blog that we've just published today. And actually that's around Hourglass's call for the strategy. So if people are interested in that, then obviously we'd love that if you could share it and get that kind of message out there.
Thank you so much, Hannah. We are just going to close up this webinar now, but I'd like to thank Carrie, to Francis, to Veronica, and to Hannah for coming to the webinar today, to Naeem for getting us sorted behind the scenes, and for everybody who joined us today. It says a lot that there was at one point over 130 people on this webinar. It shows people are taking this seriously. So thank you to everybody, and do have a look at everyone's socials relating to WEAD over the next few days. Thanks to everybody, and I will close the session down now. Thank you very much.
Thank you.
Thank you.